Well, good morning, everyone. It is great to see everybody this morning on Facebook Live. We're so thrilled that everyone can join us. And I know several people are probably jumping on, so I'll try to give us, slowly move us into the introduction of today's webinar. And I'm so excited about this one because we have just some amazing women with us, and I have a chance to be with them for the second time this week, which is really great. After we've started quite a partnership, I think, together. So it's a really an honor to be able to be with them, and I'll introduce them in just a second. We are kicking off our first of the 2021 series around healthy moms and strong babies. And we're going to be using this one this month because it's Black History Month to delve into a lot of topics that are not only about Black moms and babies and moms and babies in general, but really around Black women and the health of our health and the health of our daughters, our and Black women generally around the country. And today is going to be a really important conversation because it's also being led by Black women who are leading organizations that are focused on the health of Americans generally, of Black women specifically, looking at the issues of health equity, and really talking about leadership and what it looks like to be a Black woman leading these kinds of organizations that really try to improve health outcomes overall. So again, I'm very excited about this. Again, this is a part two of a conversation we started earlier this week with Congresswoman Robin Kelly from Chicago. We want to thank Congresswoman Kelly for hosting us. And we all agree that we got into some really good topics, but we're excited about continuing that conversation today. When we look at health disparities that Black women face in America, we need to really speak up more about these issues. And certainly we've been doing that at the March of Dimes as it relates to Black maternal health and Black infant health. But these issues around health disparities cut across multiple areas. And the speakers that you're going to hear from today are focusing on health outcomes in a variety of different areas. But there are some disturbing statistics that we can point out that will sort of frame the conversation. One of the things you've heard me talk about and others at the March of Dimes is how health inequities and then disparities really play out for Black women around maternal health, where we have 3 to 4 times the rate of pregnancy-related death and complication, mortality and morbidity as relates to Black women as compared to white women. In some places, those rates of pregnancy-related mortality are even much higher than 3 to 4 times that. In New York City, for example, it's 12 times higher than it is for white women. Black women are 40%, have 40% higher breast cancer mortality rates as compared to others. Black Americans are 50% more likely to be diagnosed with diabetes. And Black women have a 7 to 8 times higher rate of diabetes than other women and are 2.5 times more likely to die from it. Black women have on average about 15% more cortisol in our bloodstream as compared to white women. And we know cortisol is a stress hormone that is associated with inflammatory and metabolic changes, raising the risk of diabetes, hypertension, cardiovascular disease. And these are all dangerously important factors in influencing the health for Black women. High levels of cortisol have been associated with chronic stress and anxiety in the Black community, as we know, is a huge issue that we have to address. If you're wondering why these health problems exist for Black women, you're going to want to stick around because we're going to get in depth into some of these conversations about the causes. And if you are a Black woman in America, this information may be helpful to you to protect yourself, to protect a loved one. And if you're a healthcare provider or an ally in this information, we hope that you may be able to help mitigate some of these health issues for Black women in particular. So thank you all for joining. And it's now my pleasure to introduce our panelists. And again, continue this partnership that we really started last year when we were featured in a Forbes article back in November. It continued with a wonderful conversation again that we had with Congresswoman Kelly on health inequity. We had a full page ad in the Wall Street Journal, in the DC version of the Wall Street Journal, and another in other outlets as well, with an open letter to the Biden administration asking for the administration to really focus on health inequity in our communities. And then now we're continuing this conversation today. So, with that, let me just introduce this wonderful panel of Black female CEOs who are very serious about making changes at the national and local level as relates to the impact of and the health outcomes for all Americans, and especially for Black people and Black women. The first that I'd like to introduce is Tracy Brown. Tracy is the Chief Executive Officer of the American Diabetes Association, which is the nation's largest voluntary health organization and a global authority on diabetes. Tracy, who lives with type 2 diabetes herself, joined the ADA's National Board of Directors in January 2018 before transitioning to become the CEO. She was formerly a corporate executive with Sam's Club, a division of Walmart. So she brings a vast amount of experience in the private sector, her leadership at the American Diabetes Association. Tracy, thanks for joining.
Thanks for having me, Stacey.
Absolutely. And Tracy's going to have to hop off a few minutes early, but we'll continue the conversation with the rest of the panelists. So Tracy, thanks for joining. Next panelist is Linda Goler Blunt. Linda is President and CEO of the Black Women's Health Imperative. She oversees the strategic direction of this organization that is the leading organization really focusing on the health of Black women. And she has spent a career focusing on health equity and reproductive justice for Black women. She holds a master's in public health and has spent a career working in a variety of organizations focusing on programmatic impact around health, including at United Way Greater Atlanta, where she led the effort to eliminate inequalities in health, income, education, and housing. Through place-based and population-based work, Linda has been a good friend, and she's in Atlanta, my hometown. So Linda, great to see you and great to have you.
Great to see you, Stacey. Thank you.
Absolutely. And then our last but not least, our panelist is the CEO of Easter Seals, President and CEO of Easter Seals, Angela Williams. I have to give Angela a lot of credit. She's been the rabble rouser of us all. She's been herding all of us cats for some time now. We're really grateful to her. Easter Seals, as we all know, is the nation's leading nonprofit and the leading provider of services in advocacy for people with diabetes of all ages, including veterans and seniors. She's the first Black woman to hold this post. She was hired in 2018 as a change agent in anticipation of Easter Seals' 100th anniversary in 2019. She has an aggressive and ambitious agenda at Easter Seals. She has focused on broadening inclusion and awareness and empowerment for the 1.5 million people that Easter Seals serves annually, and for the 1 in 4 Americans living with disability today. So, Angela, thank you so much, and it's a pleasure to see you here. And thank you for all of your help in bringing us all together.
Thank you.
So we'll get into it, and I'm going to actually pose a initial question to the panelists, and then we'll have a conversation. And again, as usual, once we get into the conversation, I invite all of the panelists to just jump in with a response if you've got one, and then also, just want to remind everyone listening today on Facebook that if you have a question, we can take the questions, put them in the chat, and happy to entertain your questions as we get them. So if you're hearing something, put it in the chat. We'll be sure to take your question. Linda, as a national leader in health equity and reproductive justice for Black women, what do you see as some of the most critical factors affecting the health of Black women today? And talk about it holistically in terms of what are the systemic challenges that Black women face with respect to achieving a higher level of health and wellness.
Yeah. Thank you, Stacey, and thank you again for this opportunity just to have a conversation. As our founder, Billy Avery, would say, we're just going to take our shoes off and have a conversation, just kind of like women do. And to that point, the number one health issue for Black women actually is stress. And you talked about it earlier. The Black Women's Health Imperative was founded 39 years ago, right? It's been a long time, as a self-care group, because Billy Avery and her colleagues then at the time realized just how much stress Black women were under, but more importantly, sort of what the lived experiences of Black women were like and what we needed to do to help each other and help ourselves. And so for those 39 years, we've been the only national organization with this focus. And what we did 7 years ago when I started was conducted a study. We asked Black women to define health. And what turned out is that about 85% of the definition that Black women used to define health was psychosocial. About 10% was they used financial terms, and only about 5% of the way health was defined and described for Black women had anything to do with physical health or disease state. We then validated that with the Black Women's Health Study, who found the same thing. We did social media listening, found the same thing. And to sort of touch on what you said, we looked at the literature, and it turns out for more than 30 years, research has shown that stress is the #1 issue, that we do in fact have elevated cortisol levels. And much of why we are obese, have obesity-related syndromes and conditions like diabetes, like heart disease, like high blood pressure, has to do with generational experience of racial discrimination. And recently, a researcher from Emory found a causal relationship between experiences of racial discrimination, gender discrimination, and changes literally at the DNA level, these things called telomeres. Arlene Geronimus called it weathering, that Black women literally age faster. But what Tanae Lewis found was that these changes are responsible for the inflammatory responses, for metabolic changes. So for example, if you give Black women and white women the same high fat diet, Black women are going to gain more weight and gain it faster. If you give us the same low fat diet, we'll lose less weight and lose it more slowly. And so the point I want to make is, in the way we talk about things from a public health perspective or medical perspective, we tend to blame the woman. And we need to understand that these systems, the structural bias, provider bias, lead to these kinds of health outcomes. It is not because Black women don't want to be healthy. And so we've got to tackle this from a systems perspective, from a structural perspective. And like the March of Dimes, the Black Women's Health Imperative has an anti-bias training program for OB providers so that we can stop having circumstances where there are far too many where providers are not listening to Black women, whether it's giving birth or showing up in the emergency department for some other concern. We've got to make sure that systems are in place that honor and respect them and listen to them, more importantly, so they can get the care that they deserve.
That's so powerful. And Tracy, let me thank you, Linda. It just reminds us that, as you mentioned, it's not just about changes at the individual level. These are systemic, structural, societal, challenges that we have to confront and address. And I think that's really what our letter was also trying to get to, is that, we need to reshape and reform. The letter that we sent to the Biden administration was to, ask for them to help work with us on leading the country in a different way, that the systemic challenges that we face that affect our health every day are not things that Black women can fight alone, although we are taking a leadership role in trying to address our own health outcomes and express our own needs. Tracy, let me turn it to you. As obviously as a national leader of the American Diabetes Association, you're at the forefront of dealing with these issues. And we know, as we just talked about, that Black people, Black women, are disproportionately impacted by the onset of diabetes. Talk about how you see the issue and how you're looking at dealing with this issue, especially as it relates to Black women.
Yes. So thank you for the question, Stacey. And, I just want to start by saying I could not agree more with everything that Linda just laid out. Certainly, if we start with the perspective of diabetes, I am one of the 34 million people in this country living with diabetes. I am one of the 2.5 million Black women in this country living with diabetes. And, diabetes has been an epidemic in this country for a very long time. 1 out of 2 people living with pre-diabetes or diabetes. Every 2 minutes, somebody dying from diabetes. every 2 minutes, somebody having a stroke or some kind of heart-related disease. Every 4 minutes, somebody getting an amputation. Every 10 minutes, someone getting a kidney failure. But then you add on top of that what has been happening with COVID-19, and the numbers get worse. 2 times more likely to have amputations, 6 times as likely to end in the hospital, 12 times as likely to die, and 40% of the deaths have been people with diabetes. So you think about this, particularly for Black women, and you stated the numbers earlier, Stacey, 7 to 8 times more likely and 2.5 more times likely to die. You ask yourself, why is this? And I have this conversation all the time. It's not that we're genetically sicker. It's all of these other things that have been going on. And I want to start with the social determinants of health. This has been going on for over 400 years. I do a shortened timeline, but you can go back to the early 1600s in the colony of Virginia. This is where the early beginnings of defining and separating based on racial lines. You take that down to the 1790s, which is the first rules around citizenship in this country, excluded people of color. Early parts of inequity. When you are not a citizen of the United States, early 1700s, you can't buy land. Land is a form of wealth. So the wealth inequity started way back then. If we carry it down just a little bit further, you can think about in 1933, the Relief, Recovery and Reform, $120 billion of loans available, but 98% of that went to non-people of color. Keep going on down, you talk about the GI Bill. There were $95 billion of opportunities for returning soldiers, but not if you were a soldier of color. Again, education starting to come into play here. Let's keep on going down to the 1950s, 1960s, and the whole redlining. So all of these things, and we can take it down to today when you look at where the vaccines are distributed. 5% of the vaccine doses went to Black Americans. So all of that history, legislation, and policies now are what we call the social determinants of health, but it's been here for over 400 years. So we've got all of that. Then when you think about all of the studies, and Linda pointed on all of this, the life experiences that African-American women have historically accumulated over time, whether it be racial inequity, social inequity, political, economic exclusion, medical underservice, all of these things, you start to carry that stress, which makes me as a Black woman more likely to get diabetes. The inequities, the social determinants of health make it more likely for me to actually get diabetes. The data is there. And so what do we have to do? I was diagnosed, my diabetes was diagnosed as gestational diabetes. Many women have gestational diabetes, but for 80% of the women, it goes away or goes back dormant once you have your baby. I was in the 20% minority where it didn't go away. And I did not probably take it seriously. I had a very healthy baby. She's now 17 years old, the love of my life. I didn't take it probably seriously enough, Stacey. I felt great after I had my baby. And that's why diabetes is the silent killer. When you start to really feel bad, that's when you're running into complications. That means you've been living your life with elevated blood sugars for quite some time. I didn't take it seriously until my 5-year-old daughter asked me if I was gonna die. How does a child, out of the mouth of babes, that is just the craziest thing. She would see me take my insulin, and one day we're in the bathroom, she's like, "Mommy, are you gonna die of diabetes?" So that was the light click for me, but I don't want that to be the light click for other women. We have to, despite all of the inequity and what we continue to carry, take the power that we have, which is, I say, from manage what you are intaking, what you are eating, what you are putting in your body. does matter for us to navigate these social determinants of health and all of these stressors. And so I say, watch, limit your carbohydrate and sugar intake. I say, get as much fresh fruits and vegetables as you can. And if you are living in a food desert or a food swamp and can't get the fresh, then go to frozen. If you can't get to frozen, then go to the can with less sodium. But as was stated today, diabetes is taking Black women out of here. Diabetes, stroke, heart disease, alarming rates. So take the diet, exercise, just try and get 20 minutes in. Even in this COVID-19 space that we are in right now, walk around your house, walk around your neighborhood, walk around. I do TikTok. I have a 17-year-old. All you with teenagers know the TikTok and all of that. I TikTok with my daughter. That's a form of exercise. Just get it in any way that you can. And then the self-care. A thing that I personally had to figure out how to get in order because of the, the powerful Black women that we are. Usually you take care of you last. Flip that. And I say you have to take care of self first and feed and water yourself physically, mentally, in every kind of way. Then the next ring is family. And then the third ring is work. Oftentimes we have those out of order.
Priorities, yeah, our priorities.
And then the last thing, that's right. And then the last thing, Stacey, is just knowledge. Do you know what your blood sugars are? Do you know what your A1Cs are? This goes back to the medical underservice. When you go to the doctors or the clinic, ask for those. They're not normally given to you. As easy as it is that people take your blood pressure when you go in, ask them what your blood glucose levels are. So we got to take back a little bit of this, and knowledge is it. So I'm going to stop because I got all riled up now. I'm going to stop there. But we have to as a race, as Black women, we've got to do better. Our life expectancy, I just saw this data, has gone down for the first time in decades.
Yes.
Not okay.
It's awful. Yes, it's awful. And, first of all, I appreciate, and I think everyone appreciates hearing your own personal experience, Tracy, because this is very personal for all of us, and especially for you. And sharing your story is really powerful because, it goes to show you that it's not all about income levels or education levels. I mean, these things can happen to Black women from all walks of life, right? And so, I think one of the things that is really important to talk about is our personal experiences. I've told this story a lot. I know Linda's probably tired of me hearing me talk about this, but this idea of stress and anxiety was something that I found out about when I was an early teenager working in my father's office with who was a physician, and just seeing the number of patients who mostly were Black people, mostly Black women, mostly on Medicaid and Medicare in Atlanta, and how often, I mean, guys, I can't even tell you how often he would diagnose women who were suffering with diabetes, hypertension, all these other things, but the first diagnosis was anxiety. That what he treated them for in so many ways was dealing with the mental stress and anxiety they were experiencing. And he understood without even telling me, and I understood the connection at that moment when I was, 12 or 13 or 14 years old, between stress and anxiety and all of these kinds of outcomes. So that, Linda, when I hear you talk about that, it just speaks to me personally, based on my own personal knowledge. And the other thing is, Tracy, I appreciate the historical perspective too. My daughter and I on spring break went to Louisiana a few years ago, and we actually went to visit some of the plantations in Louisiana. And one of the exhibits on the plantation was talking about the causes of death on the plantation. And she and I were so shocked that when it was listed with one of the leading causes of death was childbirth, it really took our breath away. Because here we are, here I am. She looked at me, she says, Mom, you're still working on this. And we're looking at a leading cause of death on the plantation of childbirth. And we're still, as Black women, dealing with these issues now, you know, hundreds of years later, right? It's just it's really unacceptable, and it's understandable that you get riled up, because I get riled up, and I think all of us get riled up about this stuff because we're just tired of dealing with the same outcomes in the same ways, and we're calling for something different. Angela, let me turn it to you and just ask you, and Tracy, if you have to drop, we understand it. Just, we
I don't want to
appreciate
drop, so I'm going to
your
stay to the last minute.
say the last bit. Okay. Okay. So Angela, listen, this is a conversation we don't have enough of about people with disabilities, right? And we don't talk about the issue of disability in our community enough. So tell us a little bit about how you're seeing this issue as the head of Easter Seals. How are disabilities and the issues around disabilities playing out in the Black community, especially affecting Black women?
So the first thing I want to just frame is that everybody needs to understand what is a disability. And when people think about disability, they think about it's something that I have to see that's obvious. But they don't think about diabetes is a disability. Disability could come from an accident. Disability could be a part of the aging process as a senior, where there's the onset of certain medical conditions. Disability could be about mental health. If you have mental health, anxiety is a diagnosis, depression is a diagnosis, bipolar. So there are a number of ways to define disability, and there's a list. And so what we need to understand first in this country is that 1 in 4 people in America live with disability. That's the first thing. And then of that group, 1 in 4 are Black folks. And what I'll say, and I bet you every single one of us know of folks, relatives that don't want to go see the doctor and say, it'll be okay, it's going to get better. And we don't go in to get the treatment until it's too late, or the disease has progressed so far that it is really debilitating. And we could be in a situation where we're finding strokes. The second thing that I think is important for us as Black people is to become educated. And Linda, Tracy, Stacy, all of you, on our websites, I ask everyone, go look at our websites. All of our websites have a lot of information, tools that you can use, resources that you can use to learn about certain things. So for example, in the space of mothers with babies and newborns, a lot of mothers, and especially our younger mothers, aren't aware of the developmental milestones that a newborn should be experiencing, or a young child. And so they miss the signs. And we have so many stories at Easter Seals where a grandmother has had to say to their daughter, I don't think your baby is developing right. Something is wrong. You need to go and ask the pediatrician. And the mother may say, oh, there's nothing wrong. He or she is fine. The second issue is and I've seen this, where a mother will take the baby to the pediatrician and say, I think there's something wrong with my baby, and I don't know what it is. And the pediatrician blows the child off. Blows the mother off, or the caregiver. And so we have to, I would say on our easterseals.com website, we have what's called the Ages and Stages questionnaire. And if you Google "make the first 5 count," you can actually find a series of questions that when you answer them, it'll then at the end, we'll send back a report to you within about 24, 48 hours to say, hey, here's some red flags, and you do need to go back to a pediatrician and go get help. So that's the one piece around the education, but also being able to do something. I think the other thing that we as Black people don't know is what resources are available and how to take advantage of them. And it doesn't matter what your education level is. It doesn't matter what your socioeconomic position is. At the end of the day, it's lack of awareness. So we don't know how to navigate if our child is diagnosed to getting access to Medicaid. We go into hospitals and encounter systems where we feel like something's wrong. We're getting the runaround. We're getting pushback. Then we get a patient advocate that shows up. Well, guess what? The the patient advocate is not paid by you, they're paid by the hospital. And sometimes they're going to be there to help advocate for you and navigate things, but not really. Again, the onus falls on us. And when we are not emboldened, empowered, and don't have our voices and the knowledge, we are relegated to not knowing and getting the worst treatment. And then the last thing I want to talk about in our systems, it's not only healthcare system, it's the criminal justice system, it's the educational system, but it's around the inherent bias that all of us bring when we interact with people that don't look like us or come from different cultures. And that inherent bias will cause you to filter what's being said by your own experience, and your lived experience may not connect with mine. And so you don't think about the fact that my stressors could be living in the food desert, not having adequate transportation, not having the supports and services that I need to surround me, and so many other things. So again, all of this feeds into everything that all of us are talking about, but especially when it comes to disabilities, recognizing that that there are hidden disabilities that we need to be aware of, looking and understanding what the signs are, and then seeking help, seeking the resources.
That's awesome. Let me ask a quick question, and I'll ask Tracy to address it before first, and then others can chime in. Obviously, we've had a lot of the issues we're working on were a crisis before we even got into the pandemic, and now all of them have been made worse. All of the inequities have been revealed, or so many of them, and we've had to kind of lead through this.
Mhm.
Tracy, let me start with you. What kind of impact now has COVID-19 had on the population of people with diabetes? What has that meant for you and your leadership at the American Diabetes? What have you been doing differently to try to address this very unique situation we find ourselves in today?
Yeah, Stacy, I mean, it's been devastating. 40% of the deaths from COVID-19 are actually people living with diabetes. And then an even higher number of people of color. And so as the organization that is standing for 122 million Americans in this country, you can't look at that and not decide that you have to demonstrably change something. And it's not that we weren't working hard before. We were, but with, what we broke 500,000 deaths this week.
Just the other day, yes.
From COVID. So we said, look, we gotta get in there differently than we have gotten in there before. And that means when you start to think about these inequities, we've known about them for 400 years, but this has made it worse. Like, you have to get in there and start to say, how do you dismantle the inequities? Because we gotta get in there and start there. So we took a large portion of our organization and we just did a pivot that said, if we wanna actually start to take down diabetes in this country, we've gotta actually get to the inequities. And so we have this Health Equity Now platform that we kind of lined out 10 Bill of Rights that every person should have. I should have access to affordable insulin and prescription drugs. I should have access to healthy foods. I should have access to the latest and greatest medical technology. I should have access to vaccines and any other thing that I need. So great, we said we got to get to the inequities, but how you do that, Stacy? It's not, if it were easy, I think a lot of people would have already done it. We're talking about 400 years of being in the what we call groundwater. So this is a groundwater problem that requires a groundwater solution. And we know that when you talk about chronic diseases, it's behavior change. And because people feel before they think, if you don't have emotional connection and if you don't have trust, it doesn't matter. You can intellectually try to tell me anything, but if you've not connected with me and I don't trust you, I'm actually not going to change my behavior. So that forced us to say we have to get into community differently. Not that we weren't there before, but differently. And oftentimes solutions that are not groundwater solutions. We call them fish solutions. Oftentimes you're trying to fix the person. You go into community and you actually start to build the solution with the community. This is part of the reason I use this example of New York City. New York City, their biggest issue isn't that they don't have vaccines. The biggest issue is they put distribution sites in communities or closer to the communities that need it. However, it required you to do an online application process. If we had built this solution with community, we would have known that that actually wasn't the answer. And so what we had happening is the people in community not even able to get the vaccine because they couldn't sign up, yet we had wealthy, this is what the data said, wealthy white suburbanites driving in. You got to get in community. There's trust established in the community and build the solutions with the community. So that's one of the things, Stacey, we just said we've got to pivot and we got to do it fast because too many people are dying.
Too many people are dying, and I love that. I'm shocked at the number of white people in the DC area. All of a sudden, I've discovered District Heights, Maryland. It's really interesting.
Stacey, can I just piggyback on what Tracy said just for a second?
Yeah, and then Linda can chime in as well.
So Tracy, I had this whole thing that I went through last summer once George Floyd was killed. And, you know, I started pointing the finger like systems have to be changed. Systems have to be changed. But you know what happens when you have one finger pointed this way? How many are pointed back at you? And I said, wait a second. I'm a part of the system. So
Right.
if I want to change the system, how about I look at the system that I'm a part of? And with Easter Seals as a disability organization, we work with school systems. And then we work in healthcare because most of our reimbursement comes from providing healthcare services, whether it's mental health, in-person, outpatient treatment. We also do early childhood intervention. We do therapy, speech therapy, occupational, physical therapy. We have group homes, etc. So I was like, wait a second, we're part of the system. And then I thought there is a need to really focus on children. And then I said, I'm creating a Black Child Fund, and I'm going to pull together some advisors to help me look at what is the intersectionality of race and early childhood intervention. And then how do I go out and start getting partners to help me start changing the system? And I will applaud Comcast and Abbott for being my initial partners in this. But we are, all four of us are a system. And I think if the four of us continue to decide that we're going to work together, how do we decide that we are collectively going to make that change happen? Because the resources are already there. Tracy laid it out historically. There is no surprise about what's going on, why there are issues. There just has to be the moral will, the political will, and the collective will to make it happen.
Absolutely. Yes.
I have to drop. I don't want to drop, but you
No, Tracy, we're gonna keep it going. And you were so wonderful. Thank you for even giving us additional time. We appreciate it.
See you guys.
And we'll see you soon. Linda, let me turn it to you because we were talking about COVID and we're talking about systems, but we have another question too. So you can take this anyway, but I love to answer the questions from people because that means that they're listening and they want to hear. So one question we just got in from Facebook said, how does implicit bias play out in these situations? Not sure which of these situations, all these situations, I think. How does implicit bias play out in these situations you mentioned, and what can be done about it?
Yeah, that is the age. That is the question of the age. And let me just say, I am in violent agreement with Tracy and Angela. I mean, you know, I can't say it any better. But just to kind of preface answering the question, you know, a little more than a year ago, Black women were Black women. We were in no way essential. Nobody was paying any attention to us. And then suddenly, when we have the health crisis of a century, now we're essential because we're the ones who have to get on public transportation. We're the ones that have to go work in grocery stores or as cashiers or health workers who have to face that not only unmasked, but sometimes angry unmasked public. We're the ones who, when businesses started shutting down, lost our jobs, had to move out of our homes, move in with other people, or have people move in with us. So now we've got more crowded living situations, multi-generational living situations, increasing our risk along the way for COVID-19. And then don't be pregnant, because if you're pregnant and get COVID-19 and Black, you're more likely to have severe disease. So what we see now with COVID-19, you just mentioned the statistics, it was reported some 70,000 Black people have died, but we know that's not the case. That's what's been reported. We know the data are grossly underreported, and in many cases still not being reported by race and ethnicity. The actual number is probably closer to 150,000 Black people. So, we don't know where this is going, but in the wrong direction. So, this role of implicit bias, Tracy just talked about it. Where are vaccines going? Where was testing going with COVID-19 way back when? It was not happening in the Black community. It required that you had to drive to maybe an academic medical center. It was widely available in white suburban areas, required technology that not everybody has. Now we've got a vaccine. It would appear from the data that we've looked at, it is 95%, 95% effective in everybody. So that's a wonderful thing. Hesitancy actually isn't the problem right now, it's access. Because again, we could have predicted this back in March. The vaccine is not being distributed where it is needed the most. And again, if you don't have access to technology, I've got a circle of 36 people. We decided everybody's taking an hour, and there's going to be an overlap, 24/7, to monitor all the websites we could in Atlanta to see when we could get an appointment for the people that we knew were at risk, for family members. 36 people who spent literally 24/7 coverage for a week to get vaccine appointments for about 15 people who really needed it. Who can do this? If you're working, you can't be online checking to see if there's a vaccine slot available. Then you've got to get there. That might be childcare that's required. So that's a cost. Vaccines should be free. But if you're, as you all know, from low resource areas, you're likely to be offered something for pay that you shouldn't have to pay for, which you really can't afford. I mean, it's the system, again, does not work in our favor. But this is where implicit, and honestly, I'm not real sure that I'm sure that there is implicit bias. This is where it plays out in systems, in the way healthcare is organized, in the way education is organized. We have an education system that is dependent upon property tax revenues. Well, obviously that disadvantages low income people because they don't have the property taxes. We have bias where physicians, this is still shocking, but 30% of physicians still believe Black men and women don't feel pain as much as white men and women, still believe that we somehow have thicker skin. So when we go into the emergency department in a sickle cell crisis, we're less likely to get opioids because the assumption is we're there drug seeking. So, what we can do about it is training. Marcia Dimes has training, Black Women's Health Imperative has training. But it has to start at the beginning, in medical school, in nursing school, and health professional training. That's where it has to happen. But where else, and you know what I'm going to say, where else it needs to happen is, we say follow the money. I guarantee you, and to the person with the question, if we reimbursed providers and hospital systems on the basis of outcomes relative to race and ethnicity and gender, we would see much of these inequalities disappear.
I definitely agree with you on that. I think it's a really good point. And, I think a lot of folks, and we're starting to get some other questions on what can I do to help and what are some of the solutions. So maybe we should kind of turn to that. And I just want to start with this one thought. And I was actually talking to one of my board members yesterday, which is there are a lot of things that we can do, and there's no silver bullet solution to any of these things. But when you look at inequity in general, it has been, a systemic structure that we've had to deal with that has been shaped by policy over a long period of time. And when you look at inequity, it is rooted, if you look at Ibram Kendi's work and what he says about becoming an anti-racist society, what he talks about is the fact that our communities and racism shapes how we set policy and how we invest in certain communities relative to others. Because we have underinvested in over so many generations in communities of color, is why we don't have, why we see the outcomes that we see. So I'd like to just ask you all, and Angela, I can come back to you, and then Linda, but let's just kind of have a dialogue about this. What are some of the solutions to some of these changes that we face from, and I would start with, what are some of the policy things that we really need? I mean, we probably have a laundry list of them, but
Mhm.
what are the like one or two most important things that we have to focus on in shifting policy change so that we can get more and more people as advocates to help us push for that change?
So I also thank you for that question. So for everyone, if you want to join in the shift that needs to take place in the transformation that we've been talking about, you can check on all of our websites for our legislative priorities. You can join to join on to be a part of our advocacy groups. In other words, when you get our action alerts where we're saying to you, contact your congressman or congresswoman about X, Y, and Z, you can be a part of that change. And so that's how one way we would love for you to partner with us. But secondly, for example, when I look at one of the key things that's really important and it's critical coming up in the next months and year, because Congress has allocated so many funds to COVID relief, they're going to be coming back and saying, okay, now what do we need to cut? And I am concerned that one of the first places they're going to look is cutting funding for Medicaid. Medicaid is critical because it covers the health care for people with disabilities, and if they start cutting, that means people with disabilities and others, seniors, others with that are on Medicaid, low income, will lose access to quality health care, which then compounds all of the issues we've just been talking about. So when I think about protecting Medicaid, that is one of the key legislative priorities that we must continue to advocate for. And the second part of Medicaid is that the reimbursement rates are horrible. People that are caregivers, and primarily caregivers or direct service providers, are Black and brown. And they are getting paid below minimum wage. The costs, reimbursement rates are below minimum wage in a number of states. And people who would love to care for a senior or would love to care for a person with disability are leaving their jobs to go work in fast food restaurants because they can't make a living wage caring for folks. So there are some, again, when you talk about systemic and policy changes, that's one of the key things that I would advocate for, that we are advocating for.
I
And
just
I
want to do, oh, go ahead, Linda, please, please.
just to add to that, and as Angela said, on our websites, if you go to our website, there's both our policy agenda, which spells out key legislative issues and policies for Black women, but there's also the pandemic survival guide, which has lots of information and tools and strategies just to sort of get through and navigate this experience. But at the policy level, we've seen, since the civil rights era, systematic disinvestment in the Black community, to the point that we have persistent and concentrated poverty and segregation. We are more segregated now than we were 50 years ago, which is surprising for a lot of folks to know. But what we do know is if we could eliminate residential segregation right now, health disparities are eliminated. That's how closely they're connected. So we need greater investment in communities, in housing, in transportation, in access to food, so that people in low-income communities can make the kinds of choices that they would make. It's not as if low-income people don't want to be healthy. That is certainly not the case. And just to reiterate Angela's point, if we look at Medicaid, if you're a low-income woman and you have a baby and you're on Medicaid, at 6 weeks, you're off. We need Medicaid to extend a year postpartum, because I don't know about you all, but at 6 weeks, I really wasn't ready to do anything. And I certainly still needed my health insurance. But we have this, as we all know, this perception that somehow low-income people, poverty is a character flaw. And we know that's not the case. Poverty has arisen because of the systems and policies that favor the privileged and those who are born into wealth. So I would just encourage folks to look at all our websites, look at the policy agendas, pay attention to the alerts that you're getting from Easter Seals, from March of Dimes, from the American Diabetes Association, from our group, and know the issues, and importantly, know the issues in your community. It's great to know what's happening at a federal level, but Medicaid is a state-based program. So you've got to know what's happening in your state and in your community so that you can raise your voice when you see things are not working well for you and your community.
I think one of the things that I want to underscore all of that, and I think one of the things that Black women have seen and proven to ourselves is that when we come together and make our voices heard, it changes things, it changes outcomes. And we ought to not lose sight of that and not lose that sense of power and empowerment that we have. I want to underscore some of the things around policy change. For me, it's one of the most critical things that we can focus on to create change at scale. You know, when we expand Medicaid for everyone in this country, it doesn't mean that outcomes immediately change overnight, but it does mean that we begin to see progressively changes over time for large numbers of people. When the Affordable Care Act was passed, we began to see some improvement. And in states where Medicaid was expanded, we began to see improvement in outcomes for moms and babies. It actually was helping. And then, of course, we got into a process where we started to roll back some of that, and we saw some of the outcomes then slow down. Medicaid expansion, the fact that we're the wealthiest country in the world and we do not have universal health care in this country is simply appalling. We know that that exists because this is even a legacy of slavery, where you can't even point to a time when the descendants of the formerly enslaved had access to high quality, affordable care at the same level as other people in this country. It has never happened. It has never happened. And it is time in this country that we address what is simply unacceptable when you look at other wealthy countries, that everyone in this country does not have the ability to go to see a physician, see a healthcare provider affordably, that it's high quality care. Just simply is unacceptable, and it explains a lot of why we have these outcomes that we have. You know, right now there's the Omnibus Act that's been reintroduced as relates to maternal and infant care. The Omnibus Act has been reintroduced. This is a series of bills that are intended to really impact maternal and infant care in this country. We're grateful to Congresswoman Lauren Underwood, Congresswoman Alma Adams, Senator Cory Booker, who've taken the leadership of this. We're grateful for Vice President Kamala Harris, who we are convinced and know that she'll continue leadership in the White House on some of these issues, the way she started her leadership on this in the Senate when she was there. So, get involved, as everyone said, Linda and Angela, get involved with our policy changes, sign up for our advocacy alerts, be an advocate for these kinds of change, be an advocate with your own member of Congress, your own mayor, your own governor. So much of health, also, one thing I just want to underscore before we move on to closing this out, so much of our health outcomes are really affected, my dog is coming in now, by what happens at the state level. We talk a lot about the president, the vice president, Congress, but please remember that your state representatives, your state legislators, your governor have a huge impact on the shaping of health and how it plays out. We're seeing that with coronavirus. Look at the variety of ways that the vaccine is rolling out in many states around this country. We know that if we can have a stronger voice, not only in presidential elections and congressional elections, but every single day with our governors and state legislators, we can influence things and improve outcomes as well. I just want to close this out. This has been I can't believe it's already an hour almost. This has been a great conversation. And I would just say, are there some parting thoughts that you'd like to leave with the audience, Angela, on what we can do to really focus on health outcomes for Black women? What do we need to do right now? What are some of the parting thoughts that you have for our audience, just to send them on their way so we can actually make some progress together?
Become educated and active. And it starts not only with just outside of your house, but start in your house, in your household, with your family members, with friends, with your neighbors. This is, for us, a community effort. This is a grassroots effort. Once you know, and once you have the knowledge, then you have the obligation to pass it on. And so that's what I can say. We've talked about our websites. We've talked about the tools and resources that each of us bring to this conversation. And so we encourage you to be a local activist. We encourage you to agitate and disrupt what may be patterns of behavior in your own circle and in your community. So that's what I would say. Just and connect. But we all have an obligation, once we know something, to do something.
Yeah, absolutely. And to add to that, we are a 39-year-old self-care organization. So take care of yourself, but check on your family. We like to say, be your sister's keeper. Get your family, friends, neighbors on a video so you can look at them to see how they really are doing. Because they may say, I'm doing fine, but you can look at them and tell that they're really not. Check in with them, let them know how you're doing. And we're now at this point where we finally have vaccines. Go to our website or go to our YouTube channel. We have a wonderful video on what the COVID-19 vaccine is and isn't. To Angela's point, educate yourself. We need Black women to know everything they need to know what the science is, know what the evidence is, to be able to make the best decisions for themselves and their family. And I'll just end with breathe. All of this is stressful. All of this is stressful. Take a moment out to just breathe and let it go.
Yes.
Linda,
Thank you.
every time I hear you say that, it makes me, I take a deep breath.
Breathe deeply into your lungs. Yes.
Yes, it's very helpful. Well, thank you all so much. And, I know we've probably been sharing a bunch of resources on the chat, different links to different things. As we close out, I just want to say thank you to all these amazing panelists. You guys have been terrific. And I think I know you all feel the same way I do, which is, with a lot of responsibility in these positions, and a lot has been afforded to us in terms of a platform. We have a big responsibility to speak truth on some of these issues, and to really drive as much change as possible. And so I know that I'm really grateful to all of you all for doing this. I'm grateful for you bringing your own lived experiences to your positions and making a change for all Americans, and especially for those that are disproportionately impacted. I know we have a page, and I'm sure we're going to show a link, a bunch of links with all of our websites, a lot of these that were mentioned. Please feel free to visit our websites and get more information on all of these topics, and learn more and become an advocate for yourself, as was mentioned, for your families, for others. I love that. Be your sister's keeper, right? Be your sister's keeper. That's such a great thing to think about. And so thank you for that. We are, all excited about the work that we're doing. We know we have a lot more to do. At the March Times, I just want to give a plug for the fact that we're announcing a really big partnership with a company called RB, called Better Starts for All, later on today at 3:00, to really look at some groundbreaking things that are happening with respect to maternal and infant care. We're really honored to be working with RB on this, really expanding to communities here in the District of Columbia and Ohio, but with the idea that it would scale and spread across the country. So if you're interested in joining us for that, please register at this link here, and would be happy to join you all later today. So again, thank you, Linda. Thank you, Angela. Thank you, Tracy, who's no longer here, but thank you all of you for joining on Facebook Live today. And we look forward to future conversations. And I certainly look forward to working in sisterhood with these amazing women as we move forward together and working on health equity. So thank you all for joining today.
Thank you, Stacey.